All right, Mr. Davis, I really appreciate you taking time out of your day to come in here and help me get a little bit better of a picture of what's been going on with you. So basically, what I'm thinking is going on is there's some tissue and other structures in your lower back that might be pressing on one of the nerves that's in your back. And so I went ahead and drew this picture out for you. That way I could just show you a little bit more easily. So there are all these bones that get stacked on top of each other to form your spine. And in between each of those bones, there's a nerve that runs out, and then especially the one we're talking about in particular in your lower back runs out and then comes all the way down your leg. Okay, and that's why you can feel some of that pain traveling all the way down past your knee. And it's not an issue with the knee itself, but it's actually coming from, I believe, your back. So typically, when I see patients who have this type of condition or issue, they typically respond pretty well, and usually within a month or so, we can make some significant progress. That's them coming about 2 times per week for a month or so. We can usually see significant progress. Um, Now, with your job being as taxing as it is, and for you having to sit down and drive for as long as you have to, that can sometimes affect how long you're here in therapy for. That could actually make it a little bit more difficult to see progress. That doesn't mean we won't see progress or we can't. It just may make it a little bit more difficult. Um, so, do you think you coming in for about 6 weeks for 2 times per week is something you might be able to do?
Yeah, that should be fine.
Okay, okay. And who knows? We may even be able to discharge you a little bit early if we're sticking to everything and doing real well with it. We may actually be able to discharge a little bit early. Now I know that we're also going to talk to your doctor. We had already discussed that earlier about looking at the hypertension, the high blood pressure that we talked about. Um, so we'll manage and take care of that as well. That could also be something that may make it a little bit more difficult to see progress, especially with some of the exercises I'm going to be wanting to give you. But again, we're going to talk. I'm going to get in touch with your doctor. Next time you go see your doctor, I'd like for you to talk to them as well about it, just so we can all be on the same page. But again, I'll call them and talk to them as well, just to make sure that all the information is getting relayed. But so for right now, what I want you to focus on with the exercises at home is the prone press up exercise that we had done a little bit earlier. Would you mind hopping up on the table again and just showing me again exactly how you do the prone press up? Good. And back down. Do it one more time for me. Arms completely straight. Perfect. Good. And go ahead and you can go ahead and come back. Perfect. Now, we found that exercise is pretty helpful, so we're going to go ahead and add that to what we do. I'm going to have you do that for 3 sets, and I'm going to have you do that 15 times. So nice and slow all the way up, nice and slow all the way down. Okay, so 15 reps. I'm going to have you do 3 sets of those, and we're going to do those every single day. So that's something that you can do every single day, okay? On top of that, whenever you find some time to do those exercises, I'd like for you to, if you have the time, to go walk. I know you said earlier that you walk around for about 10 minutes to help the back feel a little bit better. What I want you to do is go ahead and walk for 15 minutes or so. If you're feeling up to it and you feel good, go ahead and walk for about 20 minutes. And for if there's time restraints, whatnot, 10 minutes is just fine too. I just want you up and walking, okay? So I want you to go ahead and do those 2 exercises. I want you to do them every single day, and I'll give you a handout just as like a quick reminder, like if you can't remember how many sets or reps or what exactly the motion is supposed to look like, I'll go ahead and give you a reminder for that. But again, both of those every single day. But besides the exercises, I want you to focus on how you feel after you're done with the exercises, and I want you to focus, especially today too, how you feel after you leave. That way you can let me know every single time you come back if there's any progress or if there's any what's been going on with it, okay? But besides that, do you have any other questions or comments, concerns about anything?
I have a couple. So I'm only 35. I was just
Hmm.
wondering, like, why I'm having these back pains, as well as are they going to be continuing to be an issue?
Right. Well, again, back problems in people who are around your age that's not extremely uncommon. I know a lot of times we tend to think when it comes to back problems of an older population. But with you talking to me about your football history and talking about how much time you spent playing football, that can increase the likelihood of you potentially getting some lower back pain. The job that you have, the repetitive lifting of heavy objects kind of throughout the day and for months on end, and that can increase the likelihood. So it's not as uncommon as you might think. It's actually fairly common for people in this age range to have some back pain, experience it.
Mhm.
But again, it's nothing that we can't definitely help with. So again, I had talked to you a little bit earlier about some of the patients that do really well with this type of therapy. And right now we've already found something that helps what we talked about earlier about centralizing the pain, so bringing it up out of the leg into the lower back. Yeah, the lower back might have hurt a little bit more, but that's a good sign. That's something we always try and look for, is something like that. So I'm not going to say we can fix your back problems 100% forever. But we can definitely put a good dent in it to where you're starting to feel a lot better from it. Okay.
Okay.
So do you have any other questions or concerns about any of the other stuff?
No, I think that's it.
No. Okay. All right. Well, let's go ahead and get you up to the front. We can get you scheduled for those next appointments. Okay.
Okay.
Perfect.